Hello everyone, it's Dr. Matt Ed, and today we'll look at pictures of a normal subcostal view and IVC on point of care ultrasound. Here we have a normal heart in the subcostal view, and here we have the liver, RV, RA, LV, LA, and the IVC should be around this area, draining into the RA. And as the heart's contracting, you can see that all the walls are coming in, indicating a normal heart with a normal EF. From the subcostal view, and then when you turn your ultrasound probe so the indicator is pointing towards the patient's head, you get the IVC view. Here we have the liver. This is where the RA is supposed to be, and IVC will come around this area. Here it goes. It's coming in. Here we have a still image of the IVC. To measure the IVC, we come in about 1 centimeter from where the opening of the IVC is, and then you measure from the inferior walls. So for this IVC, it's about 1 centimeters in diameter. If you thought this video was helpful, please like and subscribe and look out for my next video. Thank you.